Good afternoon. Pressure is growing on the government to reconsider its proposed 1% pay rise for NHS staff in England. Unions have expressed their anger at the plans, calling it pitiful after workers had literally kept the country alive for the past year. And the organisation, which represents NHS Trusts, say ministers had been planning to offer twice as much. They've accused them of taking money away from the heroes of the pandemic. Lewis Warner reports.
Nurses and NHS staff who've spent the last year saving lives were hoping for more of a thanks than this. The government has offered them a 1% pay rise in England, but the body that represents NHS Trusts pointed out they'd previously planned on giving twice as much.
We know that the NHS Funding Act is based on an assumption of 2.1% at least for NHS staff. It feels like the Chancellor is now taking away from the pockets of deserving NHS staff the pay rise that they were due.
The government says it can only afford a 1% rise and says it's better than the pay freeze affecting other public sector employees. The cost of that 1% is estimated to be £500 million. That's a fraction of the £400 billion pledged so far in response to the pandemic. Out of that, £37 billion is being spent on test and trace and more than £50 billion on the furlough scheme. It wasn't that long ago that ministers were clapping for the NHS, and these images will be sketched onto the minds of healthcare professionals. But after their hard work and dedication over the last year, clapping just doesn't cut it. One union now wants to see the public take part in a slow hand clap, showing the strength of anger at the offer on the table. So, what would be acceptable? A survey carried out by NHS Providers late last year found trust leaders wanted to see a rise of at least 3%, but some unions are calling for 12.5%. Labour says the government has broken its promise to give the NHS whatever it needed. A final decision is yet to be made, but the row over what constitutes an acceptable pay rise rumbles on. Lewis Warner, ITV News.